Hello and welcome to Athletic Therapy Now, a podcast for athletic therapists by an athletic therapist. My name is Ashley Burr and I will be your host. Thank you for joining us today. All right, welcome to episode 19 of Athletic Therapy Now. And today we have Shelby Daly. We're talking about the difference between AT in Canada and the US. So Shelby is originally from Kenya, Alaska. Did I
Kenai?
say that? Kenai, Alaska, and was an avid athlete growing up, specifically in soccer. She went on to play 2 years of collegiate soccer at Pacific Lutheran University in Tacoma, Washington, before she was diagnosed with a cardiac condition, ARVD, which retired her from competitive sports. The situation pushed her into pursuing athletic training. She went on to receive her Master's of Athletic Training at California Baptist University in Riverside, California. And becoming certified, she was the head athletic trainer for the professional men's arena soccer team in Ontario, Fury, California, not Canada. She was also an assistant at Caltech in Pasadena, California, and she has many experiences with a range of medical coverage from UCLA, staffing medical coverage for U.S. domestic International Brazilian Jiu Jitsu, and to onset medical coverage for films and music videos. She recently moved to Philadelphia, Pennsylvania with her husband for an opportunity to work with the MLS Academy. She's currently working towards her Doctorate of Athletic Training at Florida International University, which concentrates in entrepreneurship, leadership, and globalization. Currently, she works at Penn Medicine in Outpatient Orthopedic Department and hosts her podcast, To the Bone, which covers business and politics in sport medicine. Um, I have listened to your podcasts, and the amount of times you guys talk about jujitsu and injuries on jujitsu. My son just started jujitsu like 2 months ago. It makes me so nervous. He's 8, so they don't really do anything yet, right? But yeah, it I know there's always injuries, but like hearing your podcast, there was one episode, and I can't remember which one it was. Maybe the one about dislocation and relocation. Was that the
Mhm.
one that was really focused on jujitsu injuries? Yeah,
Yeah, that one was probably it.
yeah, that one was fun to listen to. I think David had just started,
Yeah,
like, maybe 2 weeks prior to that one coming out. So,
I would just
yeah.
tell him, "Just be better than the other guy and you shouldn't get hurt," right?
Yeah, right, yeah. Knock on wood, he's been good, so, I have faith. We'll just wait till he's, a teenager, and I'm sure it'll change.
Yeah.
Yeah, yeah. Yeah, so welcome to the podcast today, Shelby. I really appreciate you coming on and talking about your insight and your viewpoints as an athletic trainer in the United States. And so for anybody who's listening to this and isn't sure of the difference, that's what we're going to go through today. In Canada, we're called certified athletic therapists. In the United States, is it certified athletic trainers or athletic trainer?
Yep,
Yeah, cool.
athletic center, yep.
Awesome. So starting out, do you want to tell us a little bit about the schooling in I deleted all my questions. The schooling that athletic therapists have to go through in the United States. In Canada, we have it's an undergrad, a 4-year undergrad, and then there's one school in Quebec that has recently, I believe in 2023, switched over to a master's program.
Okay. Yeah, well, for athletic training, we recently just grandfathered out the bachelor's program. So originally there was uh, the bachelor's route for 4 years, or there was master's for 2 years. So getting a undergrad in kinesiology or some sort of physical education, sports science, and then you could go get your master's and sit for the BOC exam. So that fully phased out in 2022. So we're all masters now. And so we have the Commission of Accreditation of Athletic Training Education, or the CATE. That's what oversees all the athletic training educational programs. So The change was to ultimately, part of that effort to elevate the educational requirements for athletic trainers and ensure a higher level of expertise in the field. Um, so trying to compete with, physical therapists and how they were going in their trajectory of education. So, accredited athletic training programs were required to be a master's level MSAT, is what we're calling it, an MSAT. Um, the master's degree now qualifies students to sit for the Board of Certification exam, BOC, to become a certified athletic trainer. So, with the programs, we have the clinic hours, which is set by the institution. Katie actually doesn't require a minimum or maximum amount, which I just found out today, which was interesting. But there is a curriculum that they need to follow. So I know that you had asked about dislocations on relocating joints and stuff. And so basically, um, in the programs, technically it's very open-ended, so programs can technically teach whatever they want to. It all depends on the licensure of the state and your scope of practice, of your overseeing physician. So, I'll read through the list because I took a picture of it today. So, we need to learn therapeutic and corrective exercise, joint mobilization and manipulation, soft tissue techniques, movement training, including gait training, motor controlled proprioceptive activities, task specific functional training, therapeutic modalities, home care management, and cardiovascular training. So, those are pretty broad terms ultimately. So, it's really kind of up to the institution to determine what should be taught to the student. And right now, uh, obviously, there are in each state on what you can do and not do, depending on the licensure and the practice acts. So that's where it's interesting. So dry needling is a hot topic, obviously. So like Tennessee, you can't dry needle at all. Um, California doesn't have licensure, so you can technically do whatever you want as long as it's approved by your provider. So it's quite a range on the scope of practice across the US right now, which is kind of good, kind of bad, depending. Um, but it's really the educational programs making sure that the students are getting a variety of different therapies and modality trainings. And that's what's going to elevate the profession ultimately, is that we can make a case to the legislation or legislators on, hey, we're doing it in the educational programs, we have a background in it, we can technically, incorporate it into our practice acts when we do the updates and stuff. So that's kind of how the education works. Was there any questions on how did I leave anything out, I guess?
I think you got it. That's so essentially you have your undergrad and then your master's, and you have to the accredited programs have to follow a certain type of curriculum, and then what you're
Mhm.
able to practice, your scope of practice is based off of your state and licensure and all of that. And it's similar in Canada too, where we have our accredited programs and we have to follow that, and we have a very similar scope of practice, um,
Mhm.
which is your, prevention and care and sport first responder, etc. But then, things like you mentioned, dry needling. In Manitoba, we're allowed to do acupuncture, we're allowed to do dry needling because my understanding is that there isn't um, a college of acupuncturists available in Manitoba to tell us we're not allowed to do it.
Yeah.
We don't have licensure across Canada. Um,
Okay.
I believe that Quebec is pretty close and Manitoba's getting there. But it's a
Okay.
political, complicated, long process. And I mean, they've been
Yes.
talking about it in Manitoba since well before I even certified. And so it's
Mhm.
been like 15 years that I've been in this world, and I've been hearing about it. And we're hopefully almost there. Um, but then in say Ontario, where there's still no licensure for athletic therapy. but because they have a college for acupuncturists, they've deemed it not within the scope of practice for athletic therapist. So it's very
Interesting.
different from one province to another.
Yeah. Yeah, it's
Yeah.
definitely depending on how much money the acupuncturists or the PTs or whatever have to lobby against us being able to incorporate it is kind of it's all politics, you know?
Why can't we just work together? Like,
Yeah, we're just trying to provide healthcare, make it accessible.
yeah, I mean, I do acupuncture. I still refer out to other acupuncturists for other things outside of my scope of practice. I don't know. It would
Yeah,
be great. It would be great
yeah.
if, people could do that.
Yeah.
Um, so my next question, you answered my first two questions about scope of practice and the education. But I wanted to get more into that joint mobilizations. Is it because I was surprised to hear, not joint mobilizations, joint relocations. I was surprised to hear
Mhm.
that you can relocate. If somebody dislocates their shoulder, you can relocate it as long as they don't have any of the red flags that tell you
Yeah.
not to. Um,
Mhm.
but on the podcast where you were talking about that, it sounded like it's loosely taught in school, but it depends on the school you go to and potentially some of the continuing education courses you do. Um, how long has that been something that has been within the scope of practice? And how did you guys get there? Do you know?
I think we kind of found the loophole of spontaneous relocation upon palpation was what it used to be. Um, I mean, it does still depend on your physician's oversight if they're okay with you doing it. So legally, you should probably make sure that's okay. Um, but I mean, technically, you're going to have better outcomes if you relocate the joint anyway. You're getting the person out of pain. Secondly, you are most likely decreasing the risk of neurovascular occlusion. And, third, it's less emergent. You don't have to send them right to the emergency room. So if you're doing it properly, I don't think there's that much risk to it ultimately. If the conditions are right, you did your due diligence and evaluation, um, I don't think they can usually return, but I mean, that's what the jujitsu stuff is. They paid to be there. There's stuff on the line for them. They're adults. They can consent. So if they want to keep going, I mean, at that point, have your paperwork in place. But you know, I mean, they probably submitted at that point, so they're probably done competing also. So that's also a factor to it also. But yeah, I mean, it's really just have making sure the physician's okay with it, explaining to them that you understand the risk of doing it and what's the positive outcomes of providing that service ultimately of relocating. I don't. Are you guys able to relocate at all? I mean, even just a finger that's out of place, can you guys relocate that technically? No.
No, no. If the athlete can, relocate it on their own, then we can allow them
Hmm.
to relocate it on their own. But we're not allowed to do that. Has been my understanding, at least in Manitoba, based
Hmm.
off of conversations with physicians and our scope of practice. We're not taught. We're taught in first responder to. I wouldn't even call it relocation, just traction if there is any compromise in blood flow.
Yeah.
But we're taught to traction and hold it there until um, the next first responder comes along, an ambulance paramedic.
Yeah. Well, and I mean, you guys have a different health system than us, but it definitely decreased the cost to the athlete too of if you can get it back into place, stabilize, and then somebody can usually take them to the emergency room. Ambulance rides are ridiculously expensive here. They charge by the mile, but it's like $100 a mile almost, basically. from what I've seen on some things. So, and then there's the service fee of having the EMT there to oversee you and intake. So it gets expensive very quickly. So if we can help reduce that cost, even if you have good insurance, sometimes there's still that associated cost or isn't covered. So those are, the factors that we're usually considering when uh, we're making the decision to relocate or just even triaging to get them to the hospital for the next steps is, you know, is it really life threatening to put them in a car and send them on their way?
Mhm. Something to consider.
So yeah, I wanted, yeah. Well, and I was wondering, like EpiPens, are you guys able to do EpiPens? Okay.
Well, y
Or
yes, but the,
help guide
quotation
them?
marks, yes, we have to help guide them, right? As long as I think anybody's allowed to help guide them, no? Or is
Well,
that
I mean, as long as their hand is on the EpiPen.
yeah,
So yeah, those are kind of the things that, I think Katie did a good job. They recently just updated the standards, and made it a little bit more encompassing and less um, uh, descriptive, I guess, guided, so that the programs can really kind of decide what's going to be taught and stuff. So, like suturing, I don't know if you guys can do that yet.
we
Um,
cannot.
yeah, our programs are starting to teach that. It is starting to be a continuing education course that's being offered. Um, but that's something obviously the doctor has to approve. But that was my boss for jujitsu, is that he was suturing in the tent in the back of the event. It was hard because there was a lot of international fighters there and they didn't have insurance. So what were they gonna do? Go spend a bunch of money at the emergency room and, have to follow up and stuff. So um, he does it out of his garage sometimes too, because he's so well known in the community. People will be like, "Hey, this guy has like an ILAC. Can he come see you?" And he'll do it right there. So that's him and his uh, overseeing physician has an agreement to do that, and he's in California, so like it's kind of the Wild West. So he just rolls with it until probably getting in trouble.
That's really cool. No, that's not something that we're allowed to do here, but it's I wonder if it's the way that our sports run in Canada versus the US. We don't have a physician with every team, right? Like so
Yeah,
obviously with our professional sports teams, there's going to be a sports physician. I work mostly with high school football, and we're lucky if we see a physician on the field once or twice in a season.
yeah,
But also, high school football in the US is probably you're getting the same amount of people watching the game as a Canadian Football League game in Canada. Like my husband lived in Ohio for a couple years in I think middle school, and the first time he came to one of the games that I was covering, he just laughed because he was like, "This is what is this?" Like, there's
yeah,
granted, it was a really cold day, but I think there was probably all of like 30 people in the stands for the
yeah,
team. Um, and it's just not the same in the US. So there's not as much support or medical coverage for our high
hmm,
school sports um, or even university sports. Sometimes you'll have
yeah,
physicians on staff or at events, but it's not overly
yeah.
common.
Well,
Uh,
and I guess physician oversight is our written orders. So I would say that we even have the same problem here is, unless you have a very good relationship with your doctor, some of us never see them through the whole season. We're just
mm,
referring out as needed. So, so that's how I would kind of explain it, is our written orders is what I'm referring to on what we're able and not able to do. And some have very close relationships where they call and get approval before doing things, and some people don't have to do that. So I would say we're in the same boat as you guys too.
Okay. It's interesting.
Yeah.
Yeah. Cool. So my next question for you is about certification and maintenance. So,
Yeah.
do you want to talk through how it is that you become certified in the United States as an
Mhm.
athletic trainer, and then how to maintain your certification? In Canada, ATs require 21 CEUs within a 3-year period, and that's recently changed, but or how to get them has recently changed. But yeah, how does the process work in the United States?
Yeah. So I would say, we have the master's program. And so I'm not sure if it's all programs, but basically your professors approve you to take the exam. That was at least in my program, to make sure you were ready or not. So then you go sit for the exam, which is written, computerized. We don't do a practical anymore. That's how it used to be. Um, and then, take the proctored test and then you pass or not. So depending on when you graduate, if you graduate within a reporting year, you only have to do 25 CEUs. Um, if you are on an off year, you would do a regular 50 CEUs for a 2-year reporting period. So a little bit more than you guys. And then to maintain, we do have fees. Um, I'm not sure why, but recently they've started doing fees every year for the BOC for your certification maintenance. And then obviously we have the NATA membership fees, state renewal fees, um, would be the other cost associated with it. Um, so, and then with the programs, we have the normal masters, and then recently we have started a residency and fellowship, which the residency specialty areas are prevention and wellness, urgent and emergent care, primary care, orthopedics, rehabilitation, behavioral health, pediatrics, and performance enhancement. So those are still relatively new. I'm not an expert on it necessarily, but those are kind of interesting additions to the curriculum and continuing education. And then we also have a new specialty credential from the BOC, which is the board certified specialist in orthopedics, the BCSO credential. And it's basically just confirming your orthopedic knowledge. I thought it was more for hospital based athletic trainers, but it's more just specialty, I think, in the evaluation of orthopedic injury. So I guess they've seen some good results with that certification in increasing compensation and respect in your work environment. So I haven't found where they're citing that research or where they're getting that data from, but I mean, that's nice to know that there are some avenues or certifications that are actually helping us elevate through the job ladder at this point. Because I don't know about you guys, but salary's been quite a hot topic over here.
Yeah, and in Canada, I mean, the salary is different from one end to the other, right? And each province is
Yeah.
different, significantly, I suppose, based off of cost of living, but even just how well known athletic therapy is, and how busy somebody is, right? Like,
Mhm.
you go to Saskatchewan where there's I can't even get a number for how many ATs are there. I would say less than 100 ATs.
Mhm.
And then you're in Manitoba where we've got, 3 to 400 ATs. I'm just pulling those numbers out. Significantly more. And there is, one major city in Manitoba. And so they're all within, most of them are within that area, so that we're more well known than, say, if you were in a smaller town or a smaller province, smaller area. And we're a pretty small province. Um, and so that has a huge impact on salaries And again, like, and we'll get into this with the next question, but um, there aren't a lot of salary jobs where we're really more so, if you're in a clinic, typically you're in a private clinic, so you're paid per client.
Okay.
And if you're in on a sports team, then you would likely have some salary, unless it's a high school where you're paid per hour.
Yeah.
So there's a whole range, and there's nothing consistent with the type of job opportunities for athletic therapists, and so I don't think they have a lot of information on it. I mean, if you were to Google, AI will tell you that your salary as an athletic therapist is somewhere between 35,000 and like 75,000. And that's a huge range, and I feel like there's got to be people who are above that, and I feel like there's
Yeah.
definitely people who are below that.
Yeah.
So
Yeah.
it's getting better. I'm more often getting clients coming in where I'm not the first AT they've seen. Whereas when I first started, it was a whole conversation as to what an AT was every time somebody came into the clinic. So
Yeah. Well, and that's where we're getting better at spreading the word of athletic training, but we're still struggling in the public sphere of, people think that we're still personal trainers or something to strengthen conditioning, where I usually preface it with sports medicine when I say, well, I'm an athletic trainer, sports medicine. They're like, oh, okay. And then I kind of explain, well, if you watch sports, we're the ones that run out on the field and do the evaluation, and then we follow the injury to them returning to play, basically. Kind of a, short story or short summary so they get an idea that we're very encompassing in our care. Um, and so I'm not sure if you guys run into that a lot. I think it's still a new and upcoming kind of specialty.
yeah, and this is just my theory on this, and I have not looked at this up anywhere, but my suspicion is that athletic therapy in Canada, it's a newer thing. It hasn't been around that long, and I really should have gone to see how long it's been around. But I suspect we use the term athletic therapy versus athletic trainer, so that there isn't that confusion between personal trainer and athletic therapist.
Mm, yeah.
But we still get that confusion. The big confusion is, well, I'm not an athlete. I can't see an athletic therapist because, like I said, we see a
Hmm.
lot of you see a lot of ATs in private clinics where we work with, you know, people who are average Joe, who, weekend warriors or go cycling throughout the day, all the way up to your elite professional athletes.
Yeah.
And so you get those people who think, well, I only run a couple times a week. I can't see an athletic therapist, or even sedentary population where we know that we can work with that population and get really positive results to get them back to their ADLs. But just the idea that our name has athletic in it seems to make people think that they can't come and see us.
Yeah. Well, and that's where we've started updating our practice acts at the state levels. Is our old description was very much athlete based, and people took that very literally as sports. So many of the new practice acts are active population, or making sure that they're addressing the verbiage very closely to make so that we don't pigeonhole ourselves with only a certain type of population. So that's something that we are working through. Uh, but legislation is very difficult. It's the genie in three wishes. You have to be very conscientious on what you're saying because it might be not the actual outcome that you want.
Yeah. Yeah. Good old politics.
Yeah.
So So that brings me to my next question. Like I said, you're mostly going to see in Canada athletic therapists in sports or in clinics. Sometimes you'll see it in education or even in insurance, casting clinics, things like that.
Hmm.
What what's the primary job opportunities for athletic trainers in the United States?
I would say the evolution of athletic training was primarily in collegiate and high school sports. Um, as we've progressed, we're in kind of a boom right now. The industrial setting is very highly sought after right now. Professional sports is a classic setting ultimately. Sports medicine clinics, physical therapy clinics. Sometimes that can get we get kind of demoted in physical therapy clinics because we are athletic training aides or physical therapy aides, which kind of limits the skills that we can actually perform. I'm not sure where we're at on that, on trying to clean that up so that we can function at a higher level. Hospitals and rehabilitation centers, outpatient and in the OR, some athletic trainers are acting almost as or physician's assistants. When my husband had surgery in California, his surgeon had an athletic trainer as his assistant, which was very interesting. Corporate wellness programs, military and law enforcement, first responders, so police, firefighters are some of the emergent settings. Uh, Obviously, athletic training education programs, orthopedic and medical offices, occupational health and safety, so ergonomics, risk management, university and college wellness centers. I'd say that's still kind of very small, but working in the health centers at colleges with the nurses and physicians, research and clinical trials, industrial settings, arts and entertainment, so like dance, theater, Cirque du Soleil in Vegas. Uh, One of my friends used to work with like the Blue Man Group when they'd go on tour.
That's cool.
Telemedicine, telehealth, and then I mean, it's kind of open range at this point. In my intro, like I was on set for 2 films and a lot of music videos, so that was very interesting. Obviously, it was difficult without the licensure in California because I couldn't work for union shoots. But I mean, the sky's the limit at this point, and it's just how we're marketing ourselves. I mean, I saved a video or a music video for if any of your fans listen to Rufus Del Sol, but we were filming in an abandoned factory, and the director had injured his MCL a few weeks earlier, and he stepped in a hole and re-injured it. And it was, yeah, well, I can do an MCL tape job. Like, let's get you going. And
So cool.
if it was any other like medical personnel, because it's usually EMTs, and maybe nurses, but we were able to keep the shoot going. So, it's how we're marketing ourselves, and we can fit into anything we want to. So I'm not sure if you guys have limited locations at this point. We are still exploring third party reimbursement insurance. Some states have it. We're around like between 10 to 15 states that actually accept athletic trainers and billing, um, but it's not every state. So with how insurance is going in the US right now, I don't think that's the best way to make money, but it obviously does help and get our foot in the door in different areas. So I think the NATA is helping different states achieve insurance billing for athletic trainers, but it's still an interesting topic to explore and figure out because it sounds like you guys can bill for insurance.
Yeah, and so again, that's it's different in every province. In Manitoba, our association has done a really amazing job at getting us to the point where we're at. Almost every insurance company recognizes athletic therapy as the same thing as physiotherapy. And so when you get, let's say, $500 of coverage, which really is not a lot, you can have, that $500 can be towards either athletic therapy or physiotherapy.
Oh, okay.
Some of it will be, here's your 500 physio, here's your 500 AT. But most of the time, what I've noticed is that it's the same thing. Sometimes it's also, and what was more common when I first started working, and what's more common, I think in Ontario and probably other provinces, is that, physiotherapy will have $1,000 and then athletic therapy will have $100 and you need a prescription for it. And so it's like,
Yeah.
which costs almost the same as the appointment. But it is improving a lot in Manitoba. And
Mhm.
it mostly depends on HR in your workplace and what they've chosen for a plan. So all of the big hitter insurance companies offer it. And so now
Mhm.
we're in a place where your job, the person who decides to choose or gets to choose what plan they pick, they have to want athletic therapy on the plan in order for it to be covered by their insurance company.
Yeah.
Which also puts us in a position where we cannot be a physiotherapist assistant
Hmm.
because we have our own license number that's covered by insurance. We are not allowed to be assistants for chiropractors or physiotherapists as somebody who is certified as an athletic therapist. And so when you see a
Hmm.
physiotherapist assistant, at least in Manitoba, it's going to be somebody who's like a kinesiology student who's currently going through school, or somebody who's specialized and gone to college for a 6-month physiotherapy assistant program, um,
Yeah.
versus an athletic therapist. The one that I think is cool that you said was industrial. I think you had mentioned on one of your podcasts that Amazon is hiring athletic trainers to work, and I thought that was
Yeah.
really cool. Like, to have an AT on staff in your workplace to help out with workplace injuries is just so cool.
Yeah.
Should bring that to
Yeah.
Canada.
Yeah, Amazon's like the biggest I know. Amazon's probably like the biggest employer of industrial athletic trainers, but it's, construction sites. I mean, I don't know if you guys have seen on Instagram, but they have the construction workers out there doing their warm-ups and stuff. I would assume probably an athletic trainer was out there doing it. I mean, I think there's a few other specialties that are helping out with the industrial side, but it was probably facilitated by someone, hopefully an athletic trainer. But yeah, it's been very interesting with the boom in industrial athletic training. And um, ultimately, I think they're getting better data than in the traditional athlete sports setting on what all we can do to decrease cost on insurance claims. They're you know, just general insurance premiums and all that stuff. So I'm hoping that more data and research comes out to help provide better numbers on what we're saving different organizations, and hopefully it will trickle to the athletics portion too. The athletics, I think, is just such a random, you know, gamble on what type of injuries you're going to get, where you can kind of spot people in the industrial setting because it's such repetitive movement. So you can tell if somebody is more at risk because of their mechanics of lifting or picking things up. And it's kind of a condensed movement that they're doing day to day. So I think you can catch on if they're going to be prone to injuring, and you can fix it quickly before it becomes an injury. So it's very interesting. I should be having the Industrial Athletic Training Association's president and vice president on my podcast pretty soon. So keep a lookout for that one to learn more.
I definitely will. And that's cool. Like, it's that whole prevention side of it is so important, and we don't see enough of it in Canada and I think across the world. But it's we as athletic therapists in Canada, we get the post-injury side of it. So we are
Hmm.
in most provinces have the ability to work with what's called workers' compensation. In
Yep.
Canada, I don't know if it's the same in the US. And so if somebody has a workplace injury, then they can go to an AT, and they can get an assessment, and then there's paperwork. But then we can oversee and treat them throughout their, getting them back into work. And the same thing with motor vehicle collisions. Uh,
Okay.
Again, different across provinces, but in Manitoba, we have Manitoba Public Insurance, and that covers anybody's car insurance. And so if you get into a car
Mm,
accident, um, you automatically have athletic therapy coverage for your injuries, dependent
yeah,
on the stage of injury or level of injury. And they've got it pretty well laid out in the contract as to how many appointments you get for what type of injury. So, if you break a couple bones and go for surgery, you get more treatments than if you just get whiplash, like a WOD one. So
yeah,
that's really cool to be able to have that. Um, but we don't get that prevention side of it.
yeah. Well, that's where it's interesting with the industrial athletic training with the workers' comp is technically we can do all the prevention, but once a workers' comp claim is filed, we kind of lose not lose track of them, but we lose access to them. So we don't, and then the car insurance thing, we don't have that at all, I don't think, unless they came to your private clinic and were seen for it. So it's kind of interesting that it's kind of a reverse of you guys are almost better fit to be in the industrial setting with how you have the accessibility with workers' comp, where we're still kind of the before and after workers' comp, which is very interesting to me.
Okay, Amazon, this is a shout out.
Well, I'll get you in contact with the industrial athletic trainers in the US and you guys can start your own thing there. So,
Yeah, that's really cool to see those differences in that. And it's amazing that people don't see that benefit more for having an
mhm,
AT, before and after, and that follow through care, because I think that being able to work with somebody from the start of the injury all the way through to return to ADLs or sport or work
mhm.
is there's so much value to that.
Yeah, definitely.
Okay, my last question for you is about certification transfer. What information do you have on the process of transferring certification from Canada to the United States for athletic therapists?
Yeah. Well, I asked for clarification today. So basically you need to just petition the BOC to see if what you have done uh, meets the requirements to sit for the BOC examination. They used to vet out your credits from your education, but I guess that's kind of changed, and they've made it a little bit easier that if you can provide evidence on practicing as an athletic trainer and that you went through a program basically and you're certified, uh, you just have to petition the BOC and then they determine if you can sit through the examination or if you need some more prerequisites or something like that to sit for the exam. So ultimately, it seemed pretty easy to transfer it ultimately if you wanted to.
That's cool. Yeah, it sounds, I'm sure they've worked together to figure this out because there's so many ATs that just cross borders.
Yeah.
Um, yeah, because it sounds similar in Canada where you just have to make sure that you have the appropriate credentials and then
Hmm.
sit the exam. And then as long as you follow your provincial regulations, you're good.
Yeah. Well, and as I've looked into it, there is the international arrangement, the IA organizations for athletic training and athletic therapy. So the key role of this arrangement is to optimize care, injury prevention, rehabilitation, and supporting the rights of the patients and the public. Ultimately, that's what we're all trying to do to achieve their potential to live healthy. But they can create the standard of comparable programs between the different countries. So technically, the U.S. and Canada were right across the border from each other, so it makes sense that we already have a relationship. But they're also working with the Athletic Rehabilitation Therapy of Ireland and then the British Association of Sports Rehabilitators. Uh, so across the way.
Yeah, it's cool. We had we
So
had some international students from Ireland come to Manitoba at the University of Winnipeg. This was, shoot, when was this 2012, 2013? 2013,
Mhm.
2014, somewhere in that area. I had an international student from Ireland working with the football team that I was helping out at the time, and
Oh,
so that
really?
was really cool to have that experience. But yeah, it's nice that um, random that it's Ireland that's and you know, but yeah, really
Yeah,
cool that
a
we
little
have
bit.
that um,
Yeah.
the associations working together. Sorry, I totally cut
Yeah.
you off there
Well, and
because I
then
was
we
excited
actually
to share that.
oh, no. No, it's really well, and there's a lot of Japanese athletic trainers too, which is very interesting. And there is an accredited program for athletic trainers in Spain, actually, for the US. I'm not sure how the credentials work if you stay in Spain and work, but I'm hopefully figuring that out in my globalization class.
It's cool.
So, yeah.
Awesome. Well, thank you so much for coming on
Mhm.
today and sharing all this wonderful information. I'm going to quickly recap. I didn't take as many notes as I usually do, so I'm going to try to recap as much as I can from memory here and my little notebook. So, first off, we started talking about education and the schooling behind athletic training in the United States. And it sounds very similar to Canada, except that it's a master's program. And so you do your master's program, and then you have to sit your BOC exam. Same thing in Canada, where we have that. You do your university, but it's an undergrad, and then we have to sit our certification written exam. And then we got into talking about that licensing and scope of practice and how it varies from state to state. And again, similar to Canada, varies from province to province. And in that scope of practice, it sounds like the United States athletic trainers have a larger scope of practice. Again, depending on the state and what you're allowed to do within that state, but the one that really stood out to me as something that is above and beyond what we have in Canada, at least in Manitoba, was being able to do suturing and being able to relocate after a dislocation. And then, depending on where you are, is the dry needling and acupuncture. Some provinces allow it, some don't. And then
Mhm.
we got on to talking about certification maintenance. And in the US, it's 50 hours sorry, 50 CE hours every 2 years. And then all of those typical renewal fees and sitting the examination, which we talked about already. After you sit the examination, you have your different professional fees, your dues that you have, and then you have your residency and fellowship, which goes into a little bit more, it sounded like almost specialty areas where you can focus on. And then you also
Yeah.
have this specialty credential. And the goal of those two things is to elevate, um, elevate the idea and what we see athletic trainers as, to try and level that playing field with other professionals in the therapy world.
Yeah. And I
And
forgot
then
that we do have the doctorate programs too. We do have PhDs in athletic training, and then we have DATs. So the PhDs are more research-based, educational routes, and then the DAT, I haven't figured out the best way to explain it, but I mean, my program's an entrepreneur, globalization and leadership routes, so maybe more soft skills of navigating athletic training. So that was the only side note I forgot to talk about.
that's great. So is that so you have your because we've got you can get a doctorate in, I suppose, in athletic therapy. It's not a specific doctorate in athletic therapy, but in Canada, but you can get a doctorate, which again is that research based. Um, and then you said DAT was the other one.
Yep, yep, Doctorate of Athletic Training.
Okay. And is that more along, okay. Is that more along the lines of trying to progress athletic therapy in or athletic training in the United States? And
Yeah, I would say so 'cause, the PhDs and the DATs aren't regulated by CATIE, so the educational program to get the certification. So it's more specialty training, I would say.
That's really cool. Um, and then we got on to talking about different job opportunities, and again, lots of similarities in Canada and the U.S. The ones that I kind of pulled out was that are different is that industrial side of it, especially working at Amazon on the prevention. And then, in Canada, we're more on the other side of it, where we work on the rehab on that injury rehab after a workplace injury, and then working in clinics as physiotherapists assistants, which it sounds like in the US they're trying to get away from it a little bit more, but it's difficult to do. And then in Canada, we're not allowed to do that just because we have our own insurance, and that played into our
Mhm.
conversation about insurance. The other one that you talked about was being in an outpatient at hospitals or physician assistants. We have a lot of sports medicine clinics here in Canada that have ATs as assistants. Um, that's the best way I would explain it. I don't know if that's the title that they're given, but they are there to help out the physicians. But you don't see them in the
Mhm.
hospital. The only time we kind of saw athletic therapists in that kind of healthcare setting was during COVID. ATs were allowed to administer vaccines um,
Oh, okay.
under the healthcare directive that was going on. But that was really cool. And then we talked a little bit about insurance and how in the United States there's only about 10 to 15 states that recognize athletic training as a billable practice. In Canada, it is across Canada, but it depends on the province and the insurance company and the workplace. And then we got into talking about um, certification transfer, and again, it sounds like AT and Canada and the US work together with Ireland, and it's a very easy process. You just have to prove that you're certified at your accredited institution, and then you have to sit the exam, and then as long as things work out, then you can be certified in the other country. Did I
Yeah.
recap that appropriately?
Yes.
Did I miss anything?
No, I don't think so. I think we covered quite a bit, to be honest.
You did. That was a lot. I learned so much in this, so thank you. Um,
Good.
yeah, thank you so much for coming on. And I always love listening to your podcast, so I look
Oh,
forward
thank
to
you.
hearing some more from you. And for those of you listening, do you want to let us know where we can find you and information about your podcast?
Yeah, so my podcast is called To the Bone, a sports medicine podcast. It's based around politics and business and athletic training, sports medicine. Website is www.tothebonepodcast.com. I'm on Spotify, Apple Podcasts, and then on YouTube. And, just trying to ask the hard questions so that we can help progress the profession of athletic training in the US and even in Canada. It's just having that common understanding that we're all just trying to make everybody healthy and better and being able to live fruitful lives, I guess.
That's great. I also love, and I know this isn't the point of the podcast, but I love that your dad helps you with it.
Well, he was a radio host in my hometown for a few years, so he has the theatrical side and, it's easy to talk to him, so makes it flow better sometimes.
Yeah, I love it because it's such a nice thing, and I mean, I know that's, like I said, that's not the point of your podcast, but it might be one of my favorite things about it.
I'll make sure to have him on more often. Some of the guests are like, "Oh, I thought your dad was gonna be on the podcast today," and I was like, "Well, let me see if I can get him on real fast." It's not like he has a day job or anything.
It's too funny. No, I think that it's adorable for one. And I think it's just so sweet to have that. And it's really cool to see the perspective. Like you have your athletic training perspective with everything that you know and your whole knowledge, and then you have like the parent perspective. Um,
Yeah.
and I think that's nice to see that.
Yeah. I really do love bringing him on for the perspective aspect because I think we just get so narrow-minded in, the sports medicine world where I think that's kind of our flaw is that we're not bringing these outside stakeholders in to reflect and ask the questions like, why are you doing that? Uh, to try to get out of those situations. So that was one of the other reasons why I brought him on was he's good at asking those questions and asking for clarifications. So I'm hoping that he brings good light to the situations and a different perspective so we can all think of different solutions or different ways to attack the difficulties that we may be experiencing in our professions.
Yeah, absolutely. I've noticed that sometimes your dad will ask the question where you get into this conversation with one of your guests, and then he goes, "Wait, wait, wait, what does that even mean?"
Yeah,
Like, I don't even know the words you just said. So yeah, it's important to have that perspective because I think we get into a position where we don't know what we know, and we don't know what we don't know. And so to have that
exactly.
outside perspective can be really helpful in, reining us in and figuring out what we're really meaning when we're saying things. Yeah.
Definitely.
All right. Well, we'll end it there. Thank you again, Shelby, for coming on today, and I hope to chat with you again soon.
Yeah, thank you so much.